this video is in continuation with the previous video where we had discussed about the synthesis of purines by two pathways, de novo and salvage. Because here we are discussing about the metabolism of nucleotides. So we all know that a nucleotide consists of a base, a sugar and a phosphate. Sugar remains the same. If it is DNA, it has to be deoxyribose. If it is ribose, it has to be RNA. But bases are different. There is a difference in the composition of the bases. And what are bases? They are the nitrogenous compounds which are of two types, purines and pyrimidines. So right now we are discussing about the metabolism of purines, and we have discussed that purines are synthesized by two pathways, de novo and salvage. Now we are going to study the second segment, because whenever we talk about metabolism, we know that it's like catabolism and anabolism. So now we are going to study the catabolism of purines. Catabolism of purines. Now see, what happens is, that is what is metabolism all about. So if we talk about purines, what are the factors which are leading to purines? The diet, de novo and salvage. And the factors, or you can say this, purines are degraded to form uric acid. So we can say catabolism of purines is uric acid. The concentration, if we talk about it is 3 to 7 milligram per dl, which is different in males, which is different in females. Okay. So how these purines will be converted into uric acid, this is what we are going to study here. Plus what we are going to study here, if there is any abnormality in the enzyme, what are the inborn errors of metabolism associated with this. This is how we've been studying in our previous all the videos, in fact. How the particular thing is synthesized, how a particular thing is degraded, and if there is anything wrong with the enzymes, it leads to what. Okay. So catabolic product is uric acid, and if we talk about the metabolic errors of purines, they are mainly gout, Lesch-Nyhan syndrome, SCID and 𝗵𝗵 syndrome. So in this video we will be discussing each and every aspect of this. So let's start up with the discussion. Now the question is, how these purines are first of all forming uric acid. We all know that just now we have studied that purines are adenine monophosphate, adenosine monophosphate and guanosine monophosphate. And there is one very important intermediate which I mentioned, which is hypoxanthine, which is being produced from inosine monophosphate. So ideally if we see, we can simply say that adenosine monophosphate, inosine monophosphate and guanosine monophosphate are there. So these are the three principal purines. Now coming over to this, that this is going to break stepwise. It's not like that ki adenosine monophosphate immediately will be converted into adenine phosphate like that. It will be stepwise. So this adenosine monophosphate will first of all give out this phosphate, and it will be converted into adenosine. Similarly, IMP will be converted into inosine, and guanine, it will be converted into guanosine. Right? And now the question is, this AMP can be converted into IMP. this adenosine can be converted into inosine. Okay, simple if we say adenosine, inosine, one molecule of, yeah, you can say nitrogen, amino group is lost. So it's like, since amino group is lost, we can call this as deamination, a removal of an amino group. And since this process is taking place by the removal of amino group, the enzyme is adenosine deaminase. Okay, so I can say here ADA or ADA. So deamination of adenosine monophosphate or deamination of adenosine forms inosine monophosphate or inosine. Now what happens is, this inosine now will be converted into hypoxanthine. Because if you remember the previous video where I discussed that hypoxanthine is producing IMP in the presence of HGPRT enzyme. Same is the case here. And if we talk about the enzyme here, it is purine nucleoside phosphorylase. Right. So hypoxanthine will be produced and phosphate के साथ inosine is, some part is given out, left over is hypoxanthine. Now this hypoxanthine will then be converted into xanthine by the enzyme xanthine oxidase. So the enzyme here is xanthine oxidase. And here H2O2, it forms H2O2. And this guanosine can also be converted into xanthine by purine nucleoside phosphorylase. And then this xanthine will then be converted into uric acid. Again, the enzyme is xanthine oxidase. Right? So we can say that this is how AMP is degraded, this is how GMP is degraded, or in the end we can form hypoxanthine, xanthine and uric acid. So I can say that uric acid is the end product in humans, or we have uric acid as an end product. But in non-primates, this uric acid is converted into allantoin with the help of enzyme uricase. But this is not there in us. Okay, so this is very important. So we have to keep one thing in mind, that whether it is adenosine monophosphate, guanosine monophosphate, inosine monophosphate, the end product is uric acid. Now the question is, I told you that purines will be catabolized to form uric acid. What are the inborn errors of metabolism associated with it? So the most important one is gout, right, which is also known as gouty arthritis. There is a pain in the joints, whether it is the synovial fluid, there is accumulation of this. So what happens is, we can say that the most important inborn error of metabolism is gout. The first one is, now what is gout? Simply you can say inflammation of the joints or inflammation in the joints. Now why this happens? Because this uric acid is an acid, and we all know that ECF has sodium in with it. So this sodium will precipitate with the uric acid, forming sodium urate crystals, which will be precipitated. And so you can say that that sliding filament theory of the joints means the joints cannot slide with one another, leading to the pain. The movement will be difficult, and it will be difficult for an individual to move also. So that is known as gouty arthritis. So basically, what is the reason behind that? Inflammation in joints due to hyperuricemia or increased concentration of uric acid. Now, if we talk about what can be, what are the reasons which can lead to increased concentration of uric acid? There are so many reasons. Because if there is anything wrong with the metabolism, because whenever we talk about the biochemistry behind that, obviously it has to fiddle with the enzymes. So this hyperuricemia can be due to so many factors. What can be the main factors if we talk about? We have to go to the level of the enzymes. The first enzyme, if you remember, is PRPP synthetase. Second enzyme, PRPP glutamine aminotransferase. Aminotransferase. Third factor which can lead to this is glucose 6-phosphatase. So whether it is PRPP synthetase, whether it is PRPP glutamine aminotransferase, whether it is glucose 6-phosphatase, or whether it is glutathione reductase. Glutathione reductase. All will lead to the increased concentration of uric acid. Right? So I'll just highlight what happens when PRPP synthetase is not working, when this is not working, when glucose 6-phosphatase or glutathione reductase. These are the major reasons which can lead to hyperuricemia, and the most important point which we have to remember in hyperuricemia is that deposition of sodium urate crystals, which are known as tophs. Okay, so we can say that increased concentration of this leads to the formation of sodium urate crystals, which are known as tophs. Very important. Right. So now what happens is how these factors are associated. There is one more term which is also known as secondary gout. So first of all, we are going to study what is this primary gout. So under primary gout, if I say that PRPP synthetase enzyme, so first is PRPP synthetase and PRPP glutamine aminotransferase. Right. If we talk about both these enzymes, we know that whenever we talk about the feedback inhibition is what? When there is increased concentration of IMP, or you can say that IMP forming AMP and GMP. Phosphorybosylamine. Okay. So whenever there is increased concentration of this, it will inhibit this enzyme. Right. So what happens if this feedback inhibition fails? Suppose if this feedback inhibition fails, there is increased concentration of this, which will be diverted towards the degradation of formation of uric acid. Okay. Or similarly, the second enzyme, if feedback inhibition fails, then it will lead to diversion of PRPP and 5-phosphoribosylamine into the formation of uric acid. Okay. Then third important point is if we talk about HGPRT enzyme. Now this enzyme is an enzyme of salvage pathway. Now what happens is, this enzyme is required for the synthesis of guanosine monophosphate and for the synthesis of inosine monophosphate. So if I say this enzyme is absent, it will lead to increased concentration of this, along with, if you remember here what was the case, PRPP was there, which was giving PPI. Similarly, PRPP was there, which was giving PPI. So the concentration of this will increase, which will be diverted to undergo some other pathway. Okay, so increased concentration of PRPP will lead to increased production of uric acid by the increased synthesis of purines, because always keep one thing in mind, overproduction of purines, always leads to over degradation of purines. Degradation of purines, which is nothing but uric acid, leading to increased concentration of uric acid. This is very important to remember. Okay, so I can say that PRPP synthetase, PRPP glutamine aminotransferase, if they fail to undergo feedback inhibition, again it will lead to elevated concentration. Similarly, if HGPRT enzyme deficiency is there, which is a very important enzyme of salvage pathway, there will be increased concentration of this PRPP, which will be diverted via de novo pathway, forming more of uric acid. Then comes the fourth one. Fourth one is glucose 6-phosphatase deficiency. Now, if we talk about this is nothing but this is von Gierke's disease. So, this is von Gierke's disease, and if you remember, glucose 6-phosphate has to be converted into glucose. But if this glucose 6-phosphatase enzyme is absent, it will lead to increased concentration of glucose 6-phosphate, which will be diverted to form undergo HMP shunt. HMP shunt, more ribose, which leads to more purines production and leads to more degradation. So this is another very important point. So I can simply say that this is glucose 6-phosphatase deficiency. Whenever glucose 6-phosphatase is deficient, the concentration of glucose 6-phosphate will increase, which will enter HMP shunt. HMP shunt it will lead to the production more of ribose sugar, which will lead to overproduction of purines, leading to over degradation of uric acid. So again, this hyperuricemia can again be due to the deficiency of glucose 6-phosphatase enzyme. Then if we talk about the fifth one is increased activity of glutathione reductase. So if there is increased activity of glutathione reductase, it will again lead to increased HMP shunt, because glutathione reductase is the one which is actually converting oxidized glutathione to reduced glutathione, and it requires B2 for its activity. This enzyme we have already discussed so many times. So, increased HMP shunt leading to increased ribose sugar, again leading to increased uric acid. Okay, so these are the main 5 enzymes which are required for producing gouty arthritis in the males and in females also, because there is a difference in the concentration of uric acid in males and females. Then second is secondary gout. This was primary gout. Now what is secondary gout? Now if we talk about secondary gout, there are so many other reasons which can lead to also uric acid. The most common one, if I talk about different type of cancers, right. Similarly, we can say that any kind of trauma in the body, any kind of injury in the body, right. So you can say starvation also to some extent, starvation, or psoriasis. So many reasons are there, but they are indirectly related to increased concentration of uric acid. So they all will lead to hyperuricemia. And always remember, whenever there is increased concentration of this uric acid, it will precipitate with sodium which is present in the ECF, forming sodium urate crystals. So these sodium urate crystals precipitate. Right, and they form the tophs. So basically tophs are the ones which are being produced by hyperuricemia. So this is primary gout and secondary gout. So sometimes what happens is, this is the gouty arthritis you can say. Now sometimes what happens is there is accumulation of some other crystals also, which are calcium pyrophosphate crystals. But there in that individual, the concentration of uric acid will be normal. Okay, so I can say that sometimes deposition of, which can give a wrong picture also, deposition of calcium pyrophosphate crystals also deposit. Also there. Okay, but here this will be actually known as pseudo gout. It looks like gout. The patient will complain of the pain in the joints only, but there won't be an increased concentration of uric acid, there will be calcium pyrophosphate crystals. So I can say it is known as pseudo gout, false gout, and uric acid will be normal here. Right. Now the question is, what are the factors which can lead to gout? Now the most important factor which can lead to gout is again the seafood, the food, and the second one is alcohol. Alcoholism also leads to the increased concentration of uric acid, and sometimes what happens is metatarsophalangeal joint is the first joint which is always you can say done by this gouty arthritis. I'll just show you the picture. You can see that if we talk about, this is the indication of gout. There is deposition, there is swelling in the metatarsophalangeal joint. Here, joint. And alcohol also contributes to this. So I can say what are the main factors which can lead to gout? Obviously the first one is the diet, and that too the diet which is rich in seafood. Seafood, and then you can say meat and all, ham, chicken, they will lead to increased production along with alcohol. Because alcoholism also interferes with the metabolism. Okay. So this is, and you can see that there is deposition of uric acid crystals everywhere. So it can lead to nephrolithiasis also, right? So this is gout or gouty arthritis where there is hyperuricemia. And what are the factors which can lead to hyperuricemia? Start with PRPP synthetase, PRPP glutamine aminotransferase, HGPRT, glucose 6-phosphatase, and glutathione reductase. So these 5 main enzymes will lead to increased concentration of uric acid. And then we come over to the treatment of gout. Now, treatment of gout includes, obviously, the first one is, you can say, if we talk about the drug of choice in gout, it is allopurinol. Allopurinol is considered to be a drug of choice in a patient who is suffering from gouty arthritis. And what is the reason behind that? Because this allopurinol is a competitive inhibitor of xanthine oxidase. Very important. So basically what happens here is that hypoxanthine, initially just now we saw that hypoxanthine is being converted into xanthine, and this xanthine is being converted into uric acid. The enzyme is xanthine oxidase, Now why allopurinol is known as drug of choice? The moment the uric acid level comes back to normal, the patient can stop taking that drug. So this allopurinol is a competitive inhibitor of this. So whenever allopurinol is taken, so it is going to form allo-hypoxanthine, okay, and alloxanthine. So both allo-hypoxanthine and xanthine are water soluble and they are excreted in urine. Very important. And that is why this is an example of suicide inhibition. It's not the body has committed suicide, it is just, that is why it is known as a drug of choice, ki the moment the uric acid level will be normal, the person can stop taking this drug. So allopurinol is known as the drug of choice, which is the competitive inhibitor of xanthine oxidase. So obviously the concentration of uric acid will come back to normal. And the second one is colchicine. So this colchicine, which can arrest cell division, it can also treat gout. And the different uricosuric drugs. And if we talk about the uricosuric drugs, the most common of them are uricosuric drugs. The most common is indomethacin. Indomethacin can be taken, corticosteroids can be taken, so many can be taken, which will just make uric acid soluble so that it can be excreted in urine. So this is first inborn error of metabolism, gouty arthritis, or commonly which is known as gout. Then second one is Lesch-Nyhan syndrome. Lesch-Nyhan syndrome. Now, the most important feature about Lesch-Nyhan syndrome is it is X-linked. X-linked, that means only males are affected. And if we talk about the root cause here, the root cause is here there is complete deficiency of enzyme HGPRTase. This enzyme is absent. And the main clinical features in Lesch-Nyhan syndrome are the child or the male who is affected by the complete deficiency of HGPRTase will have self-mutilation, will have a urge to bite his own fingers and toes. This is very, very important. So, self-mutilation will be there. Tendency to bite the fingers, tendency to bite the whatever parts, body parts are there. Self-mutilation, along with this you can say uric acid will also increase, that I have listed just now, why there will be increased concentration of uric acid. So obviously if there is uric acid increased concentration, it will lead to gout also. And the most important one is the IQ level will be low and he will have an intellectual disability also. Intellectual disability, or there will be neurological manifestations too. Manifestations. Now, so this is Lesch-Nyhan syndrome. Then there is one more syndrome which is due to incomplete or partial deficiency of HGPRT enzyme, and that is 𝗵𝗵𝗵𝗵 syndrome. 𝗵𝗵𝗵𝗵𝗵 syndrome. So if we talk about this, here there is partial deficiency of HGPRT. So it is due to partial deficiency of HGPRT enzyme. Same factors, but here you can say it's mild than Lesch-Nyhan syndrome. Neurological manifestations are not seen. It's a very mild, I would say, syndrome. So this is 𝗵𝗵𝗵𝗵𝗵 and that is Lesch-Nyhan. And the third one is SCID. SCID, and this SCID stands for severe combined immunodeficiency syndrome. And if we talk about what is the deficient enzyme here, the deficient enzyme is ADA, adenosine deaminase, or ADA. And what is this enzyme doing? It is simply converting adenine monophosphate, adenosine monophosphate to inosine monophosphate. So what will be the clinical features here? B cells and T cells, biochemical manifestations will be B cells and T cells will be damaged or they won't function. Okay, so you can say that these are the main inborn errors of metabolism associated with purines. The most important one is gouty arthritis. The second one is Lesch-Nyhan syndrome, and the third one is SCID. Gouty arthritis ka I told you what are the main reasons which can lead to gout. Basically there is pain and inflammation in the joints. Alcoholism do interfere with the uric acid metabolism. So automatically whenever a person has consumed alcohol and whenever a person has taken so much of the non-veg food, there are more likely causes of the increased uric acid. And the drug of choice in uric acid, drug of choice in gout is always allopurinol. Allopurinol is a competitive inhibitor of xanthine oxidase and it is an example of suicide inhibition. Second comes this 𝗵𝗵𝗵𝗵𝗵 and Lesch-Nyhan. Lesch-Nyhan syndrome is very, very important. I will just show you the picture also of Lesch-Nyhan syndrome. What happens here is the individual who is suffering from this, he has a tendency to, it's like self-mutilation. So he has a tendency basically to bite his own fingers, as you can see here. right? So this is Lesch-Nyhan syndrome, very, very important. And the most important feature of this is it is strictly X-linked. X-linked means it is present only in the males. So males are the ones, males are actually, it's like they will suffer from this Lesch-Nyhan syndrome. And if there is partial deficiency, that is 𝗘𝗵-हि syndrome. 𝗘𝗵-Hi syndrome is very mild, the symptoms are not very severe. Urological manifestations are rarely seen, they are not actually present in 𝗘𝗵. And third one is SCID, severe combined immunodeficiency syndrome, where the deficiency of enzyme adenosine deaminase is there, which you can see here. I will just take you to the main pathway. Here you can see ADA, right? So this is adenosine deaminase. Very, very important, right? So it will lead to SCID, right? So this is all about the inborn errors of metabolism associated to purines and the catabolism. And that is what we say, the factors which are giving rise to purine should be equivalent to the factors which are utilizing purines. If there is any abnormality, it will lead to a disease. So that's all. I hope this video is clear to all of you. Thank you so much.